how did you get Padma Shri?
Padma Shri was not the most exciting award. The recognition by your peers is a bigger award, because if your peers recognize you, I feel that is the real Padma Shri for a doctor.
So you are also one of the pioneers who developed endoscopy.
I chose was because endoscopy was evolving. There was something which you could do with your own hands and you could master that skill, and I could see that this is going to go for very far.
The most wanted branch was cardiology. Everybody wanted to be a cardiologist. But now I see the shift happening towards gastroenterology.
There was not a single department of gastroenterology in practice, in private sector, in the entire northern region of India. I was the first postgraduate from All India Institute who opted for gastroenterology as a specialty.
Can a man be successful without sacrificing work-life balance?
The problem with doctors is they do not spend money on unimportant work. Try to do all that yourself. First advice to youngsters is start delegating non-professional work to somebody else. You have to use technology. Once you do that, you get additional time as a bonus to spend with your friends and family.
Hello everyone, welcome to Delhi Docs, जहाँ white coat सिर्फ कहानी की शुरुआत है. Our today's guest is Dr. Randhir Sud, Padma Shri Gastroenterologist. He is the chairman of Institute of Digestive and Hepatobiliary Sciences at Medanta. So let's quickly dive into the podcast and ask him about his journey from AIMS, Gangaram, and then to Medanta, and ask him, does gastroenterology today also make sense, or is it saturated? Welcome, Dr. Randhir Sud, sir. Thank you, sir, for coming.
Thank you.
Sir, straight away I want to ask, so when I was doing MBBS, it's not too far back, in 2007, the most wanted branch was cardiology. Everybody wanted to be a cardiologist.
Yeah.
But now I see the shift happening towards gastroenterology. In fact, most of the MD students also want to take gastroenterology and skip cardiology. Sir, how did this change happen?
See, in fact, this is what you have to realize when you choose a specialty. So what's going to happen with that specialty tomorrow? Because
Right.
it will take you 3 years, maybe 6 years if you're deciding after MBBS to come and become that specialist. So you should look at what is going to happen after 6 years to this specialty, and by the time you get established, it may be a decade. So I joined gastroenterology in 1980 in All India Institute.
Okay.
At that time, possibly I was the first postgraduate from All India Institute who opted for gastroenterology as a specialty. In fact, tremendous pressure was there for us to join cardiology, neurology, but we decided gastroenterology. The reason I chose was because endoscopy was evolving.
Okay.
There was something which you could do with your own hands, and you could master that skill, and I could see that this is going to go for very far.
Oh, it should improve with time.
Yeah.
Okay.
That is the reason gastroenterology I chose at that time, when not many people even thought of it.
Which options did you had at that time?
No, we had an open field because, you do your post-graduation MD from All India Institute. That time, competitive, you are trained from the best institution. You can choose any specialty. So cardiology and neurology was given to us on platter by the chiefs of the departments. They wanted us to join. In fact, I and one of my colleagues, Manu Tandon, we were the only two postgraduates from All India Institute who joined DM from All India Institute. And both joined gastroenterology.
Wow. And sir, you had cardiology option, you had neurology option, gastro option, and what other option?
See, the problem was that time the endocrinology was not there in DM. There was no nephrology DM in All India Institute.
Right.
So these are the only two medical specialties which are available.
Okay.
In fact, these three at that time.
And sir, it's been an amazing journey. You even reached up to the heights of Padma Shri. So, sir, it's really good for us that you chose gastroenterology. Sir, you are also one of the pioneers who developed actually endoscopy. So, can you take us to that journey?
See, endoscopy has been my passion right from beginning. And as I told you, I joined this specialty because I saw endoscopy as, like a warrior chooses a weapon.
Acha, nice.
You choose a sword, you choose a gun, you choose any fighting weapon.
जी sir.
And I thought endoscopy is the weapon to further your career.
Hmm.
So I chose endoscopy. And at that time, when I, after completing my DM from All India Institute, I joined the Sir Gangaram Hospital in 1985.
Okay.
There was not a single department of gastroenterology in practice, in private sector, in the entire northern region of India.
Okay.
So,
Hmm.
in fact, I and my mentor, Dr. Sama, we were the first people to start a department of gastroenterology in Sir Gangaram Hospital in 1985. And
Okay.
it has been an amazing journey, and so we started promoting endoscopy, started first establishing endoscopic procedures in
Hmm.
Gangaram, then started promoting it to the others because there was no avenues for people to learn it.
Sir, did you face resistance from medicine guys or GI surgeons? Because it's kind of overlapping into both their arenas.
See, fortunately, uh, endoscopy at that time was not a very glamorous area
Okay.
because there was
Hmm.
very limited scope. It was predominantly a diagnostic facility.
Right.
The instruments were not very, very good. They were,
Hmm. The cameras and everything.
cameras. Vision was not very good,
Hmm.
and surgeons were far too busy doing surgery than look into endoscopes.
Right.
So, I think at times in history, you get an opportunity
Hmm.
to grab something which is going, it's like you get a rough diamond and you know that you can polish it into a really amazing piece.
And sir, if you compare the endoscopy in those times, how much it has evolved, what are the avenues it has opened up?
See, today, fortunately, when I look at the journey of endoscopy, because I have lived through it over the last 40 years,
Hmm.
I see that from a diagnostic modality, it has changed into a highly specialized therapeutic modality.
Right.
Like we do there was a time when we were doing only palliative procedures for cancer of the food pipe. We were
Hmm.
putting in stents. We were doing gastric outlet patients with advanced gastric or duodenal malignancy. We were putting in duodenal stents. These also came much later in late 90s, the
Acha.
self-expanding stents. We were
Okay.
putting plastic stents in the esophagus. So it was crude. The first thing which we treated very effectively was the bleeding from upper GI in varices,
Where is
but it was
this?
only injections. Bending
Okay.
came much later. So
Okay.
today you have sophistication in devices, you
Hmm.
have got sophistication in endoscopes. Now in my department, we have very highly endoscopes with very high quality vision, magnification, where we can detect early gastric cancer, early colon cancer very easily.
Sir, you have named so many diseases. So now, gastroenterology has also further specializing.
Oh, yes.
Uh,
See, the two drivers in gastroenterology has been instrumental in promoting this specialty, according to me. One
okay.
has been the research in liver diseases, hepatology,
Right.
and then culminating into liver transplant and patient care after liver transplant, and
Hmm.
endoscopic procedures. Because this has actually propelled this specialty, into a very aggressive specialty. So today, we have luminal gastroenterology, where we treat luminal diseases, and the
Hmm.
endoscopic procedures associated with like upper GI, lower GI endoscope, and pteroscopes. They are
Right.
there. We treat tumors, we treat bleeders, we treat take out polyps. Then we have pancreatobiliary endoscopy,
Okay.
where we treat pancreatic diseases, we treat biliary diseases, stones, tumors, and
Hmm.
necrotic collections of pancreas, pancreatic stones in chronic pancreatitis, and strictures.
Hmm.
Then now a new thing has come in, which is third space endoscopy.
Okay.
And third space endoscopy is that you go beyond the mucosa of the intestine, and
Hmm.
between the mucosa and serosa, you create a submucosal space. You take out tumors and you do dissection of the muscle. So, like,
Very interesting.
no,
Wow.
it is
Uh,
actually very very satisfying, because you don't give a cut outside the body. You go through the
absolutely.
normal lumens
Hmm.
and do it. And then endoscopic ultrasound is one device
Hmm.
which has actually made all the difference, because now it gave you ability to look beyond the lumen of the intestine and look at the
Hmm.
adjoining organs. So with endoscopic ultrasound today, we treat biliary diseases, we treat luminal diseases, we treat pancreatic diseases, even intraperitoneal abscesses. So lots of things have happened.
Sir, if somebody comes to you, for example, an MD student, asking you about gastroenterology as a career option,
Hmm.
sir, will you motivate him? If yes, how? What will you say to
See,
join it?
yeah. See, gastroenterology is still not saturated like
Okay.
cardiology.
Okay.
Today, cardiology is a relatively saturated branch, and the high end interventions are TAVI and all. They are done by few, very expensive.
Right.
So not within the reach of every person. So it's not something I'll say. And neurology, unfortunately, neurology is something you can spend hours together thinking about it, discussing
Oh.
about it, but very little you can do about it.
Right. Yeah.
So that's the problem with neurology.
Uh,
So if you are chess master,
uh,
you should go into
yes.
neurology.
Brainstorm
Okay,
more and more.
brainstorming, and only lift your hand when you're moving a piece,
Yeah.
and otherwise.
Right.
But if you like to do things with your own hands,
Hmm.
and you not only think, you can treat a patient on your own, and
Hmm.
or predominantly, then I'll always motivate these people to join gastroenterology.
Also, without procedures monetarily, it makes little sense because procedures is where the money is, right?
See, I'll tell you a very interesting thing. I listened to a presentation by McKinsey,
Hmm.
which was actually projection of private Indian healthcare way back in 90s.
Okay.
And gastroenterology did not feature in their game plan at all.
Acha.
They never thought, or never were aware that gastroenterology could be a specialty which could earn money.
Okay.
But let me tell you today, gastroenterologists across the country are possibly more satisfied monetarily and professionally than other specialists, because these non-invasive procedures are quick, they're
Hmm.
paying, and the patient goes happily, and they're satisfied.
Right.
So, and even if there are two parallel procedures available,
Hmm.
patient's option is to do something which is less invasive.
Absolutely.
So they go for endoscopic procedures than
Right.
surgical procedures.
So, what do you think about the city-based specialty for gastroenterology? For example, if we take gastroenterology into tier 2, tier 3 cities.
Yeah. See, that's a very important question, because many of my younger colleagues now have lesser option of developing independent practices in metros, because
Hmm.
place is very expensive. Then the risks are very high, and then it costs a lot in terms of work-life balance.
Absolutely.
Okay, so they can be master of their own in a tier 3 or tier 2 city
Okay.
after initial, but then they have to be pan gastroenterologist. They have to treat entire spectrum of gastroenterology, hepatology, and endoscopy.
Hmm.
They can't focus on a particular area of gastroenterology in tier 3 cities, because
Right.
patients will come there for treatment of various aspects of gastroenterology.
But do you think they can set up a clinic with possibly a daycare room and a procedure room, and that would suffice? Or do they need some attachment with a bigger
See,
institute?
the problem is that today, with the way our endoscopic procedures have progressed,
Hmm.
a daycare facility and indoor facility is a must,
Hmm.
unless you want to limit yourself to diagnostic procedures.
Okay.
So just having a clinic and a outdoor facility
Hmm.
will not be professionally satisfying.
Hmm. That would be again like a physician.
Yeah, that's you
Hmm.
can do that if you want to expand your services or have a outreach of your services. You're stationed in one place in a tier 2 city, you want to
Right.
cover another place in tier 3,
Hmm.
and or adjoining place, then you can have an establishment there which is of daycare facility,
Hmm.
and bring the patients for indoor to your bigger facility.
Right. And sir, what do you have to say about corporate attachment or working in a corporate hospital versus the purely academic career of a government hospital?
See, I will not say academic career of government hospital. Government hospitals don't have academic career. You
Acha.
know, it only is few institutions which
Right.
focus on academics, like
Hmm.
Colony Institute,
Aimstead, yes.
PGI Chandigarh, etc., are focused on both the practical or applied gastroenterology as well as academics.
Hmm.
Uh, when it comes to choice, I think a person has to decide. First, what is his intention? To be financially secure and grow up a ladder which is, a path which is already existing. But then he has to travel the same steps which are there, set up by the corporate.
Right.
He
It's a
can't
linear
make, yeah,
progression.
it's not a, it is a path which he can,
Yes.
he can make on his own. Because corporates always, remember, in India, you don't have, the trust-based hospitals or charitable hospitals which are encouraging you to spend a lot of time in research or teaching. End of the day, they are looking at your
Revenue.
revenue generation.
Absolutely.
So you have to understand when you're joining that you are joining professional organization which is focusing on revenue generation, but you can still do honorable ethical practice in that and generate revenue for yourself and for the institution. But
Right.
when it comes to career, I will say that when it comes to starting your own, some people have the courage to make their own institutions. Then you have to look at your colleagues, that you can gather and do a group practice,
Team
team
Right.
practice. Then you have versatility. You pull in your resources and then develop that. But that is a model which will exist in tier 2, tier 3 cities, not in metros, because metros, the corporates are too big now to let small competition survive.
Absolutely. Right. Sir, you have worked in Gangaram for 25 years.
Yeah.
Then now in Medanta
For 15 years.
For 15 years. Wow, sir. So there is a concept, or let's say a thought process going on circulating in the general public, that corporates put a lot of pressure on doctors to generate revenue and probably put them into unethical practices. Like we were talking about ethics and revenue. So what do you have to say
Let
about
me
this?
tell you, I can speak for Medanta and Gangaram.
Hmm.
Gangaram is not a corporate entity, but run by doctors.
Right.
I was part of that, organization for 25 years, and I was part of executive committee, board of management. There was never a pressure to generate patients or anything, because there were far too many doctors, but very few rooms. Space was a constraint. But
Okay.
that pressure is not existing. When it comes to a place like Medanta, which is again spearheaded by a doctor, a professional, this pressure is not there. Till date, I can vouch.
Right.
Nobody has come to me to say your numbers are this. Yes, you are given your charts of progress in over the years. Then as a team leader, you look at it. Then look at because after all, if you are a team leader, you're looking at the careers of your people attached to you. I've got a career of around 15 people attached with me. So I have to look at that. What is going to happen to them after 5 years? So I strategize. I see which area they can specialize on, how they can get more patients, how they get more skilled. So all this has to be looked into. But this is not under pressure from the hospital. This is from the planning perspective.
To achieve excellence as well as achieve
Absolutely.
revenue. Right.
But I can't speak of the other hospital, but I have heard that pure corporate entities, they do nag doctors about the numbers.
Right.
And I tell you another thing, that a hospital like Medanta, no administrator ever calls you to his office.
Achha,
They come to your office.
Probably, sir, because you are so
No,
senior.
it's not
with
me. It's not me.
Achha.
This is an ethos that everything, doctors are there in the hospital to serve the patient. And entire system of administration is there to serve the doctors, to serve the patients better.
Nice. So that's
a defined rule. So they have to come to you, even if you are wrong, to tell you where you are wrong.
Okay, great. Sir, let's talk about the journey from Gangaram to Medanta. Sir, why would you, end your 25 years of practice in such a reputed institute and then move to another city?
Yeah, this was a very difficult decision.
When did this happen, sir?
This happened in 2010.
Okay.
Decision was taken in 2009.
Okay.
When Medanta started. And why I had no problems in Gangaram. In fact, it's a wonderful place to work in, because it is like a family environment there.
Okay.
Problem there is that the infrastructure there is still very restricted. Like I tell you that you are a painter. You have a canvas which is of size at 2 feet by 2 feet. You can paint on it. You want a bigger canvas to paint on. That canvas was not there.
Right.
And if you could pressurize to give you that canvas, you would have treaded on toes of so many of your friends who were looking for the space. So that's the time I was looking at a different place where we could expand faster. And then when we found an opportunity with Medanta, where it was spearheaded by a doctor who was visionary and who
Right.
gave you free hand to develop a specialty and of the size you wanted.
Okay.
So that's why I moved.
Nice. And sir, what about Padma Shri? How did you get it? Why did you get Padma Shri? And how can we as medicos aspire to get Padma Shri? Because it's
See,
one of the highest recognition.
let me tell you, I don't think Padma Shri excited me that much. The reason I tell you
Okay.
that Padma Shri, nowadays people make a lot of effort to get themselves nominated.
Right.
Somehow I was nominated by somebody whom I had worked, as a doctor for the gentleman, and he thought that I needed to be nominated for this award.
Okay.
So I was nominated.
So that's how it works. Somebody nominates
you, but now you can apply also.
Okay.
But then this goes through scrutiny. The list gets shortlisted after seeing your credentials and all, and then only after, if there is no legal or financial sword dangling on you, then only you are considered fit to be given that. So this also depends upon the government of the day, because now the government of the day has shifted from medical to social workers.
Okay.
And of course, part of it becomes political also. So that's why I say Padma Shri was not the most exciting award. The recognition by your peers is a bigger award.
Okay.
Because if your peers recognize you and honor you, I'll feel that is the real Padma Shri for a doctor.
The recognition by peers came before that?
It keeps coming in different ways.
Okay.
Initial recognition comes when you are asked to be the faculty, be the keynote speaker, be to various major events. Then you are given awards for excellence. Then the final comes with a peer society lifetime achievement awards. So that kind of recognition comes. Recently I got an award, International Services Award in Endoscopy from American Society of GI Endoscopy. These awards matter more than the Padma Shri.
I think, sir, another aspect of peer recognition is when the faculties of different departments come themselves as patients or send their mothers and fathers.
That is recognizing your professional skills and your talent.
Right.
And that is very satisfying.
Absolutely.
Because that means that your own people have faith in you.
Right. Now, sir, my seniors from MBBS times and juniors, now they are sending patients to me, so it feels really
good. It is a great feeling because you do feel very good with this.
Right.
And particularly when some VIP comes to you, either a big business person or a administrator or a politician, then they come after a lot of scrutiny. And if they keep coming repeatedly, that means you are delivering the services well.
Yes, and people are recognizing.
Yeah, absolutely.
Right. Sir, coming back to the monetary aspect of gastroenterology, sir, if I ask you directly, how much would you say a DM gastroenterologist would start earning?
See, normally I have worked on this a lot.
Okay.
A DM has spent so much of time trying to specialize in the field. 6 years after MBBS minimum.
Absolutely.
And that is a hard work which has gone in, and you have already gone into this because you deserved it. I say that beginning, if you are in a corporate hospital, should not be less than 3 lakhs to begin with per month. Okay. If you are in practice, then if you go into solo practice, you should be earning at least 50% more. because you are also to look at the expenditure you're
Absolutely.
making, the money you're losing on absenteeism if you go on vacation, etc. So you should be earning around 5 lakhs or so to be equivalent to 3 lakhs to begin
Right.
with.
Right.
And for a person who is starting his practice, without any lineage, that father was not in in practice, then you start early. But if there was no lineage, then you have to be actually earning double that amount, but 6 lakhs per month, to be equivalent to a corporate. That's why there is a attraction for corporate employment.
Right.
And then, of course, what is wrong in corporate structuring is that the monetary reimbursement to our younger colleagues should keep on rising according to the contribution. There should be a formula of a transparent formula of their professional contribution, of their research contribution,
Right.
and if they're adding an additional aspect to your department. So that's a very important aspect, because that brings in side stream business to you.
Yes.
So
The research won't bring any revenue.
no, it will not, but it will
Yes.
bring in recognition.
Recognition,
And the
reputation.
peer recognition is very important, I told you.
Right. Right.
So it takes your standard of your department higher, but the person needs to be reimbursed for that.
Right. Absolutely.
So that these things need to be worked out by the team leaders and the team together, that how much to reimburse a person.
Yes, sir. Sir, talking about work-life balance especially.
Yeah.
So I have talked to a few greats like yourself, and people have different answers to this. Sir, what is your opinion? Can a man be successful without sacrificing work-life balance?
See, I gave a talk recently on being successful and happy.
Right.
Okay. Because you can be successful, but you can be unhappy by the end of it.
Absolutely.
Okay? So you can be happy only if you have achieved what you tried to, and your near and dear ones are also with you in that journey. So when we talk of work-life balance, I don't talk of it as a two pans which people show on the pictures of one going up, one going down, like in a balance. It's not that. You bring the life into your work first. That means you start enjoying your work. If you enjoy your work, you are already achieving part of that work-life balance, because you're not unhappy by the end of the day. You're happy with whatever. If you are unhappy with what you're doing, stop doing that, and look at the way you can be happy doing your work. Right. Second thing is that, yes, your family has to understand your compulsions, because in the beginning, all of us have to devote far more time to professional work and trying to bring up our careers. But later on, you can think of balancing it.
Right.
If you start doing, thinking of that, I have to go home at 5 o'clock, and I have to be with my family, it will never work. Then you will not be achieving excellence in your work. So for this, you need a very understanding spouse. My wife, she sacrificed her career for first almost 4 or 5 years, till our younger son was almost 3 years. She didn't work. So it was her contribution towards my career.
Right.
So then after that, she's also a doctor, and she started working after that. So one has to have a very understanding partner to do that. But right, now our work-life balance is basically spending not the amount of time, but the quality time with your family and your children, now with my grandchildren.
So it becomes better with time for doctors.
It does become better, but one has to learn how to strategize. You have to use technology. You have to learn to delegate your work. The problem with doctors is they do not spend money on their backroom services. You don't spend on a good secretary. You don't spend on a good PR person. And you don't spend on a chauffeur, so you try to do all that yourself. Then once you have not delegated the unimportant work to somebody else, you end up losing that time. So my first advice to youngsters is start delegating your non-professional work to somebody else. You will actually get compensated in multiple times for the salary you pay to this assistance. Then use technology for
right. That's very interesting advice, sir. Yes.
So once you do that, you get additional time as a bonus to spend with your friends and family.
Bilkul. Makes sense. So you have seen endoscopy evolve through the years. So where do you think GI's gastroenterology, for that matter, is going in future?
See, you should, whenever you're looking at future, you should look at what do you have today, and you should also look at disruptors.
Right.
That what is the technology or the coming which can disrupt this game. So what is the biggest disruptor in your mind? Is AI.
Absolutely.
Because now I find that AI will disrupt people doing only algorithmic work. Like a physician diagnosing a disease. He asks a patient 5-6 questions, arrives at a diagnosis, and then asks for investigations.
Right.
Looks at investigations, then gives the diagnosis. That is algorithmic work.
Bilkul.
AI can do that better than him or her tomorrow. So I imagine that there will be AI kiosks tomorrow in the malls. You are falling sick, you just go there and click on, and the device or the bot will ask you questions, and you answer those, and bot will tell you which investigations, and they will arrange the blood sampling or the investigation for you.
Right.
And maybe the driverless car will be standing outside to take you to that place to get investigations done. And you will get those investigations that comes in the system, and the bot will tell you on your mobile, your diagnosis, this is your prescription.
Right. And maybe if needed, he can tell you need to see a specialist.
Absolutely. So this is what is going to happen in future for the algorithmic work. But wherever there are manual skills, like in endoscopy, bot can't do the endoscopy. In fact, it will be productive to you in telling you during endoscopy whether you have done the procedure completely. So it will upskill the level of a mediocre level skilled endoscopist or a low level skilled endoscopist to the level of the a very skilled endoscopist.
Right.
So it will keep helping you that look at this area. Now we are using
the planning itself.
We are using AI for detecting polyps in the colon.
How, sir?
This is we call this is a computer aided device that it is attached with our new endoscopes. The moment we are looking at the colon, we are retrieving, we switch it on, it keeps on putting on the green squares or anything which it thinks is a polyp. Then you look at that again, and there is evidence in literature that it increased the polyp detection rate by 15%.
Wow.
Which you naked eye would have missed it. So we are already using it. Then it is coming to diagnostic, that it can tell you while you're doing the procedure that it is malignant, it is non-malignant. So that's also evolving. And then it will also tell you whether this is worth going endoscopically, that can be treated endoscopically, or should you send to the surgeon, or you should do radiation. So this is where it will help. So I personally feel that this is the way it is going to evolve. And it is going to be only, serving a sort of a adjunct function for a skill level person like surgeons, for endoscopists. But for algorithmic, it may take over.
Right. So probably the general physicians
not only general physicians,
in danger.
like I'll tell you, hepatologists who are not doing very procedures. The AI can now diagnose.
In fact, it can analyze so much more data more accurately.
Absolutely. So that's what is going to happen.
Right. Learn a skill, I would say. Yes.
Yeah. So neurology. Maybe you will not need neurology. It will the MR is MR, EEG, everything is integrated to AI, and it will give you what is needed. And
the questionnaire scores, they could also do that, right? Yes, sir. Very interesting. Right. And sir, you talked about surgery also. This is one question I want to ask. I asked a cardiologist also the same question. There is significant overlap between intervention cardiology and CTVS surgery. Similarly, there is a significant overlap in intervention gastroenterology and GI surgery.
You see, earlier we used to compartmentalize a lot. That is my specialty, it's your specialty. Now we are looking at jointly. Like in my Institute of Digestive and Metabolic Sciences, GI surgery is part of it. So we look at the patient problem or the disease treatment rather than the specialty which is going to treat. So then you decide which is the right patient for a particular intervention. Yes, there will always be options. These are two options. You give it to the patient. Patient chooses. You decide to go to Mumbai from here. You can go in Rajdhani. You can go in by plane. You decide.
Which is more risky.
Yeah, whichever you can afford, whichever you think is more productive for your work.
Right, right. So you think that the disease-based practice should
Yeah,
be given
it will be
importance?
disease management
Uh,
focus, which will help the patient more than only specialty focused thing.
hmm,
It should not happen that a person comes to me as an endoscopist and I see what to do endoscopically rather than do what the patient needs.
hmm. Right, sir. I think this is also a good future tip. You should
Yeah,
focus on a disease
yeah,
in its entirety
absolutely,
and not just think of the surgical
absolutely.
or
The training has
medical
to
part.
training has to change.
Hmm.
It has
Right,
to become integrated.
right, right. Sir, international fellowships in gastroenterology, what is your opinion about them?
See, earlier we all used to seek it out because the avenues for learning were hardly available in India.
Hmm.
Let me tell you, when we wanted to see some advanced procedures or big people doing a procedure, we used to spend our own money, go to places like Hong Kong. There used to be a very important workshop there,
Okay.
and sit tightly there, or go to European GI Week, UGW or DDW, and learn all that.
Okay.
Now the things have changed.
Hmm.
The avenues for learning are, and the volumes for that
Hmm.
are so huge in our country that you can actually master the skills much faster here.
Okay.
Yes, I will say the fellowships are important for people who want to do something which is not yet existing. Say there is a person who wants to do research in future.
Hmm.
So exposure outside, particularly in an academic institution in Europe or US, is important. Then I'll give you an example. I sent my own son Sukrit to China
Acha.
to learn third space endoscopy because Chinese are masters in this, Japanese are masters in this,
Okay.
and the Chinese have volumes and they let you do hands on.
Wow.
So today I can proudly
Hmm.
say he's mastered the technique because he spent 3 months there. So
Right.
it's a short fellowships with a particular purpose rather than
Hmm.
just spending 2 years with nothing
Hmm.
in mind.
It's a structured
Yeah,
fellowship
absolutely.
where you probably get hands-on and a curriculum,
Yeah,
and
yeah,
then you come
yeah.
back.
You
Right.
see, hands-on for technical skills,
Hmm.
but for even if you go to an institution where there's research, you learn methodology, you learn
Hmm.
the new areas which they are looking at. Okay,
Hmm.
so then you can identify disruptors in the practice tomorrow.
Right. Right. Well said, sir. And sir, another thing about social media for doctors. So it is very difficult to find you on social media. But what's your opinion?
See, I'll say we are from the dino age, and the social media came much later.
Right.
So for me, even WhatsApp is a waste of time because I see people scrolling it down and deviating from some productive work. But I feel that for youngsters, being on social media is very easy way of networking
hmm.
and trying to be visible to the rest of the community.
Right.
And I'll say that today social media is something which you have to be. Unfortunately,
Hmm.
we now we don't need it at my age, so
Huh.
I don't find the need for it
Right.
because people of my age only keep posting their photographs of their
Uh,
vacations rather than anything important.
right.
So this is more of a fun rather than
Like the real social
yeah,
media.
yeah,
Social. Because I feel, sir, today in social media, the social part has gone somewhere.
yeah,
It's mostly media.
yeah,
People have forgotten the original media. They are
right,
consuming social media for the media part.
absolutely,
And
absolutely,
its social word is
yeah,
gone.
yeah.
Probably
So,
not. That's
but
not
I
the
think
case with
for
you.
youngsters it's essential,
Hmm.
and
Hmm.
I think they're far more savvy with it, and than to take advice from me
Hmm.
because I need advice from them.
That's so kind of you to say that, sir. But I also feel, sir, that the people who are on social media right now are too young to comment on such vast fields like gastro and those kind of things. So I feel it's very important that you guys, greats like you, who have at least 30-40 years of experience, who have seen the medicine evolve over the years and who can actually predict future possibly better than us, they should come and talk about these things and guide us because
Yeah,
yeah.
I'll need somebody to
uh,
teach me how to use social media.
Sir, always there for you.
Yeah.
So, before we finish this, I want to ask if there are any cons of picking up gastroenterology as a DM.
See, I'll not say there are any cons today. because it is a well-established specialty. It's growing still. It's not a saturated specialty. It's both the branches, hepatology as well as now Lumina also is growing because there are new biologicals, new therapies coming in. Then the interventions are rapidly growing. So I will say there is hardly any connects. Yes, it becomes time intensive because if you get hooked to endoscopic procedures, then you start enjoying it. It's like a golfer, who loves his game, spends most of his time there, and then sheepily comes back home,
waiting to go another their back.
So that's what happens because it's addicting and invigorating both.
Nice. So I would say in summary, it's a very exciting field to be a part of right now.
Absolutely.
Right. I think, sir, this was a great podcast. I have asked all the questions I wanted to ask. Thank you for coming to this podcast.
Thank you very much.